You're most welcome to this video. It's Friday the 22nd of January. Obviously quite a few changes have gone on in the United States, so we're going to be looking at that. And I think we've got some news from Canada and Australia as well. But I'm going to start off with the UK first of all. Now I'm going to start off with the good news, and I'm going to look at the COVID symptom tracker app. So we see the number of new daily cases is still high. These are symptomatic cases, but much less than they were. And it tells us that Wales and London are currently the highest number of new daily cases. And we can see the other parts of the UK there as well. And when we go down to look at the prevalence, this is the number of people who have the infection at the time, just now, the prevalence. And we see this is going down, hasn't been updated for today yet. But it peaked up there on the 10th of January. I'm going to come back to that in a minute. First of all, United Kingdom, this is the death figure over the past 7 days. Now, this is remaining high, well over 1,000 deaths a day on average for the past 7 days. In the United Kingdom, totalling 94,580 deaths within 28 days of a positive diagnosis. And the other thing I've noticed is the news coverage on the BBC. Now, the BBC has its own agenda, and it does have a lot of covert messaging in the BBC, but it's become fairly overt in terms of the pandemic now, because there's news coverage of hospitals, which there was in the first wave. But what there wasn't in the first wave is there was no news coverage of morgues, bodies being put into mortuaries, and there was no news coverage of grave sites in the UK. Whereas yesterday they had a fairly graphic image of a grave digger panning out to the broader increased cemetery demand in parts of London. Now, this is a radical change in British culture, and it's deliberate. It's a deliberate sort of more. This is the reality of the situation. So very obvious change in the reporting from the news media in the UK. Hospitals, pictures of staff being upset, morgues, graves, and to me, this is just showing something more of the reality of the situation. Even it's pretty toned down, of course. Italy had a lot of this sort of coverage in the first wave, which I don't know if there's any data to say whether it's good or bad, but it does make sense that people are aware of the situation in real terms. So coronavirus, COVID, coronavirus disease symptom tracker app data from the Zoe data, which we've just looked at. Now, Tim Spector, in charge of this, has just said that new cases peaked on the 1st of January. And to be fair, this is a lot earlier than I would have thought. But if it's what the data shows, it's what the data shows. Now, remember, this is incidence. This is number of new cases per day. Professor Spector saying peaked on the 1st of January. Now, I know we've just looked at this, where we saw that cases were still high on the 10th of January. But of course, the people that got sick on the 1st of January down here would still be sick for a period of time, because these are the people that were symptomatic on any given day. So this graph is the prevalence, but Professor Spector is saying that the incidence, the number of new cases, peaked on the 1st of January. Earlier than I thought it would have been, but we go with what the data says. So that's what we currently believe, and the prevalence and the incidence have both been going down. So the incidence, the number of new cases, has been going down since the 1st of January. The prevalence, the number of overall cases, has been going down since the 10th of January. But we still notice that we're at a very high level. I mean, there's still a lot of people with the disease in the UK at the moment. 651,465 people that are symptomatic. Now, what this means is if you live in the UK, there's a fairly good chance if you socially interact, you're going to bump into one of these people. Or it could be, unfortunately, that you are one of these people. Therefore, you need to protect those around you. So I think it's worth reinforcing that. We're at a high prevalence at the moment. And that means we're still in a dangerous situation and must behave accordingly. Now, cases now falling in most parts of the country. There are a few exceptions, but most parts. And the COVID symptom tracker app estimates 0.8 for the whole of the UK. So cases are decreasing, and I think the evidence is clear on that from this data. I'm not going to look at the government data. We look at that every other day, really. So, but it is showing this downward trend as well. So, signs of encouragement. But there are buts, because we've noticed that the deaths are still high. Now, Professor Spector also said there's a decrease in cases in the younger age group, which is good. 20 to 40-year-old age group declining. In London, 55% of the hospital beds are occupied by COVID patients. So we'd normally be fairly full this time of year anyway. Now, the good thing about this year is the prevalence of influenza is still remarkably low. We would normally have a lot of complications of influenza in at this time of year, such as exacerbation of chronic obstructive pulmonary disease, which we get on an hourly basis in A&E departments. So they're down, but 55% of patients have COVID in London and about 33% in other parts of the country. Still not a sustainable level, especially in terms of critical care capacity. Now, her hospital cases plateaued on about the 16th of January, according to the COVID symptom tracker data. But plateaued as opposed to start going down. So they are now at a remarkably unsustainable level. And of course, more people are still coming in at this high level. And the total number of patients in hospital continues to increase. So it's not sustainable. But because the cases went down here, then the hospitalisations will start to go down soon. And the COVID symptom tracker data is saying hospital admissions should start going down next week. Now, this is the number of new admissions should start going down next week. There's still going to be an awful lot of people in hospital. Still, it's unsustainable. But the number of new cases should start going down next week. Deaths will stay high for the next 2 weeks. So for the next 2 weeks, I'm afraid we can expect well over 1,000 deaths a day. That's 7-day figure for the next couple of weeks because of these lag effects that we know about. So that makes sense as to where we are at the moment. Now, very often in the past in this video, I've expressed disappointment at people's behaviour and said, what don't they get? Well, now everyone gets it. The people that are breaking the rules now don't care. It's that simple. They are being callous with the lives of others. Everyone now gets it. You'd have to be living on Mars not to get these messages now. Everyone knows, maybe not the precise detail of what they're allowed to do and what they're not to do, but they've got a pretty good idea that you don't go to parties or pubs. So people that are breaking the rules now are callous and profligate, cavalier with the lives of other people. The time for excuses has gone. And this is reflected with Priti Patel, Home Secretary, announced that pretty shortly fines of £800 of anyone attending a house party of more than 15 people. Now, believe it or not, this means that people are attending house parties of more than 15 people at the moment. I mean, when you think of the sacrifices the rest of us are making, and yet some people are behaving in this way in the UK, it really is good time that the law started to take note of that. The fine doubles for each repeat offence, so I don't think there'll be many repeat offences, up to a maximum of £6,400. Organisers for events can face a £10,000 fine if there's an illegal gathering of 30. And we have seen this in the in raves and mass parties and things that are just not for this period of time. So Ms Patel says, not standing by while a small number of individuals put others at risk. And it is a small number, but it's enough to cause super spreader events and cause massive increase in the disease when most of us are obeying the rules sacrificially. You know, if you're watching this video now, then you're the sort of person that is making real sacrifices to try and get this pandemic under control, whether they're in your personal life, whether it's in your financial life, in your social life, that these are real sacrifices, your mental health life. we are making sacrifices. So it's right that a minority aren't allowed to flaunt the rules. Martin Hewitt, chairman of the National Police Chief Council. Police forces are telling us there has been a significant increase in recent weeks in rule breaking and partying particularly. Now, partly there's been an increase, but partly it's because the police are now looking out for this problem in society much more now than they were. So, for example, just a couple of examples here. Brick Lane, East London, more than 40 people at a house party. Officers actually injured, 3 officers injured, I believe, breaking that up. Tower Hamlets, there was a party of more than 40. In Dalston, I think that's an area in London, a pub was found to be open. A pub actually open, flagrant breach of the law. And Metropolitan Police offered 140 FPNs, fixed penalty notices, last weekend. So these fines are now being implemented much more, which but basically has to be a good thing. Now, quick review of Northern Ireland, which we haven't looked at for a while. Lockdown in Northern Ireland extended to the 5th of March. That's not surprising, but it's a devolved administration. Restrictions until after the Easter holidays are probably going to be there. Non-essential retail closed. Work from home where possible, of course. Family gatherings are prohibited. Orders to stay at home. So much the same as other places. It's just that this is passed in an individualised basis. Schools are closed for most pupils until after February's half term, at least. And the government in England has said that schools will be given a 14-day notice before they have to go back. Now, a lot of the problem in Northern Ireland especially, but all over the UK and indeed in the States, which we were warned about by the new incoming head of the Centres for Disease Control yesterday from the States, Christmas relaxations were a disaster. R went up to 1.8. I mean, wow. Now it's down to 0.65 to 0.85 in Northern Ireland. So Christmas was a bit of a disaster, I'm afraid, on both sides of the Atlantic. So this is the R in Northern Ireland now, so on the way down, but at great cost. Case numbers are still higher than in the first wave, though. We've still got high case numbers, even though the total numbers are now coming down. And hospitals are 3 times busier than they were in the peak last April. So signs of encouragement, but coming down from a very high plateau is the problem. Now, moving on to the United States, lots of interesting changes, of course. Now, this is the figure for deaths in the last 24 hours in the United States. It's really quite horrendous. And it's going to increase. We know it's going to increase. It's utterly inevitable. It's going to increase. So, President Biden moving in, signing executive orders. This is a direct quote. Let's be clear, things will continue to get worse before they get better. This is, unfortunately, correct. Sad but true. Deaths will top 500,000 by next month. This is also true. It's inevitable that 100,000 people are going to die of COVID-19 in the United States in the next 4 weeks. An extra 100,000 deaths. And that's what we call baked into the numbers, unfortunately, from the infections that are already there. But good to see that Mr. Biden is aware of that. Still wants 100 million vaccines in 100 days. Good. Vaccine centres at stadiums and community places, so sort of mass vaccination centres. A bit like the UK model actually going to be implemented in the States. Good. International travel after test negative before departure. Okay, better than it was, but there's still the possibility for people getting infected after they've been tested or for false negatives there. Self-quarantine for 14 days on arrival. Depends how that's going to be monitored and how that's going to be policed, but it's certainly a step in the right direction. Masks and social distancing on all federal government property. Now, apparently the President of the United States doesn't have the authority to mandate mask wearing everywhere. because of the devolved nature of state authorities in the States, which I don't pretend to understand the details of, but I know is limited as to what he can mandate. But I think it's mandatory in airports, including domestic airports, and on many planes, trains and buses, which apparently he is able to mandate. So having said that, mask wearing in the States is pretty good, but it needs to be higher. And we did look at that predictive data from Washington State University on how many lives. I think it was 30,000 lives could be saved between now and the 1st of May if mask wearing went up to about 76% where it is now, if it went up to 95%. Huge difference. We know these things now. There's going to be a new office, a new secretariat to coordinate the national response. So this seems to be part of the sort of philosophy, really, of the new administration, that they're going to try and be more federal, national in the response rather than devolving so many things to state level. Just hope that doesn't start causing debates between state level and national level, as we've seen already, which don't really help. Now, Defence Procurement Act was instigated by the previous president. President Trump actually instigated this. Mr. Biden seems to be going to... President Biden seems to be carrying on with this and ramping it up. More PPE and more supplies needed for the vaccine production. So that's like the components that go into the vaccine are going to be covered by the Defence Procurement Act. And supplies will basically be ordered to start manufacturing these materials. And they will do so. He's also going to form a pandemic testing board to supervise testing. New research is going to be instigated on treatments for COVID-19. No details on that. We'll look at that with interest. At the moment, we have no effective curative antivirals. Remdesivir has some antiviral effect, but no specific antiviral, so that would be good. A lot of the developments, like the dexamethasone, have been, and the tocilizumab, have been to treat the symptoms rather than to kill the virus directly. So, but you know, if the United States gets going on that, I wouldn't underestimate them. Now, strengthen collection and analysis of data to shape the government's response. Good, because I've had so many emails about this that people are struggling to trust the data, the official data from the United States, that the data was collected in a different way. So President Biden is committed to more transparency in this, and we look forward to that. Because some of the data from the States has been ambiguous. The 198-page plan. He's obviously been working on that for some time. White House unit global health. There's going to be a White House unit for global health security and biodefense. Now this, I believe President Obama started something similar to this, but President Biden's going to carry on with this now. Biodefense, and we have talked about the next pandemic, which could be much more deadly than this one. So it looks like there's a joined up approach to that, which is good. They're going to join the COVAX, which is the WHO program for distributing vaccines globally, and they're going to continue World Health Organization funding. Now, this one is there's been question marks over the WHO, basically, hasn't there? I mean, you know, I'm on record of saying I believe this pandemic is unnecessary for various problems that happened in well over a year ago now. But just to try and put some specifics on that. Just a bit about the World Health Organization. 25% of WHO staff work in Geneva. So looks like that's quite a lot of admin staff, because they're not dealing directly with clinical cases in Geneva, presumably. So quite what's going on there, not too sure. These staff report directly to the Director General, apparently. Now, the World Health Organization has a huge budget, apparently. I mean, there's plenty to do, but 4.4 billion apparently in 2017. That was according to this reference there, if you want to check that one out. Apparently, the Director General has a 1.5 billion pot to distribute, to disperse himself for what he thinks is appropriate, according to this chap here. So, how has the World Health Organization performed? Well, this is David Fidler, Adjunct Senior Fellow US Council on Foreign Relations. You had the authority, you had the ability to challenge China for the early lack of transparency and the fact that the flights went on for so long. The flights went on. The World Health Organization basically said keep flying in and out of China way later than I thought they should have done. To question China as to what they were doing, and you needed to do that for global health, you failed to do it. So pretty strong castigation of the WHO there. So, you know, throwing money at the World Health Organization is not necessarily a panacea. There was a petition of over a million signatures, which is now closed, to replace the Secretary General of the World Health Organization. Let's just say there are other exceptional people readily available who could fulfill that post if that was considered appropriate. Now, there's been an independent panel set up to look at this. Check it out for yourself. I haven't spent much time researching it yet at the moment, but an evidence-based. I like the fact that it's evidence-based there. Quest to protect human health. So, and there's some. This is led by a couple of intellectual heavyweights. So the Helen Clark, who was she was the Prime Minister of New Zealand, I think, wasn't she? And Ellen Johnson Sirleaf, who was President of Sierra Leone, I think. So they're looking at that. I haven't watched this video actually, so click on the link. I've given you the link. Interesting stuff. And they're looking at this now. So the published stuff recently, 19th of January. Looking, so I'm going to plan on looking at that in a bit more detail. And they're certainly instigating this critique and looking at how things can be improved moving forward. So criticised the World Health Organization for not declaring an international emergency until January the 30th. Okay, that makes sense. These are the people in charge. Yeah, it is. Helen Clark was New Zealand, President of Liberian President. Ellen Johnson Sirleaf. So they are in charge of that. A direct quote from the site, or rather, direct quote from the. Can't remember actually if I got that from the news or from the site itself, but one or the other. But what is clear is that the panel, to the panel, is that public health measures could have been applied more forcefully by local and national health authorities in China in January. Okay, that speaks for itself. As evidence emerged of human-to-human transmission in far too many countries, this signal was ignored. So the reason I started looking into this was I looked at the transmissibility of this virus. And I looked at the flights that weren't stopped, and I looked at the reaction in China and Taiwan. And I thought, well, if the Chinese and Taiwanese are reacting as vigorously as this, and we know that we're dealing with a highly transmissible virus, and we're still flying around, it's inevitable. I mean, it's not. This is not. I haven't got any sort of contacts in high places in the United Nations or anything. It was just obvious, just from those facts. And yet, you know, we were bouncing up and down about this January, February on this channel, and yet this signal was ignored by so many. How can there be such an international blind spot? I don't know. Although the term pandemic is neither used nor defined in the International Health Regulations 2005, So it's not an official recognised term, which the World Health Organisation often said. So this is really sort of weasel words here. I mean, everyone knows what the word pandemic means. And to say we're not using the word pandemic because it's not officially prescribed terminology to me is ridiculous. You know, if the World Health Organisation had been bouncing up and down in January, February saying pandemic, stop flying, do everything, you know, people would have understood that, but they didn't. They didn't. They first used the pandemic word on the 11th of March. I mean, good grief. You know, when the word pandemic was used, people, I think, sat up more and noticed. But for that not to be done is an omission which really needs to be explained. Its use does serve to focus attention on the gravity of a health event, which is exactly what this specialist panel is saying. That is in direct quote. The panel's called for a global reset because when the next pandemic comes, it could kill a lot more people. It's going to make recommendations in a final report to the health ministries of the 194 WHO member states in May. So we look forward to that. So it's easy to sit here being grumpy and cynical, but this is a serious international panel now, going to make serious recommendations to 194 that's basically every country in the world, isn't it? 194 member state governments in May, and it will contain a critique of the early response from many people concerned. Now, I've heard nothing at all about the World Health Organization team that's gone to China to find about the origins of the virus. If you've heard, let me know. That's gone quiet, hasn't it? So frustrating. I still feel we're in an unnecessary pandemic. Sometimes I get a bit angry about it, but we are where we're at. We've got to go on, but looks like there could be changes coming as a result of this, as a result of that project. So do click on the link. Don't take my word for it. It's that one there. It's posted in the description. Click on it. Read for yourself. Canada. Now this is very disappointing, I must say. You know, Canada made a really early good start, early authorisations of the vaccines, and I was saying I thought Canada might be one of the first countries to vaccinate most of its citizens. Well, it's not, but it's not any fault of Canada's, apart from the fact they haven't authorised the Oxford AstraZeneca vaccine. They really need to look at that as an emergency. Government of Canada has purchased more vaccines per capita than anyone else, so they're being very proactive. Supplies temporarily have been halted by Pfizer, as we understand, as they're expanding their facility in Belgium. So it seems that the Canadian Pfizer vaccine is coming from Belgium. It's flying in from Belgium. And the Pfizer factory in Belgium is being revamped, so the production's down, so the Canadians aren't getting any at the moment, as far as we know. So severe supply problems. They really need to look at the Oxford AstraZeneca because that could be made in country. Anyway, the delay on the Pfizer is 4 weeks now. This is just terrible. It's a terrible delay for Canada. And that part outside their control. They've asked for US Pfizer vaccine. Whether that happened or not, don't know. We'll watch with interest. Mass rollout, so basically is going to be delayed till April now, finishing July, August. So you got to feel for the Canadian authorities there, really, that they were very proactive. They've purchased more vaccine than anyone else. They took basically what were gambles on new vaccines being authorised. Some were, but why on earth they're not doing the Oxford AstraZeneca, which could be made in country, is a mystery. I don't know why they're not doing that one. And of course, the United States aren't doing it yet. And President Biden didn't. I'm used to saying Mr. Biden. It's President Biden now. Didn't seem to mention that unless it's part of that 194-page document. Obviously, I haven't read it all. Now, another. I think this last story is good news. I think so. Western Australia, Premier Mark Gowan they've identified 6 cases of the UK strain. This is the B117 2012 English UK Kent mutation, whatever you want to call it. 6 cases identified. But they're all safely tucked up inside quarantine hotels. You know, if Australia did not have this supervised system, the more virulent UK strain could be running riot through Western Australia as we speak. But it's not, because they control the flights and they control the quarantine and they control the testing. You know, is there any reason why every country in the world couldn't have done what Australia did? You know, because countries, what was the expression there? Not taking it seriously or something like that, wasn't it? This signal was ignored. So the signal was ignored as evidence emerged of human-to-human transmission. In far too many countries, this signal was ignored. Well, in Australia, it wasn't. And they now reap the benefit of that while we are suffering. So I am delighted for Australia. 6 cases identified of this new variant. Now they've all served their time in quarantine now, so 1 is still active, man in his 30s we believe, but the other 5 are now over their infectious period, over their period of quarantine. South Africa variant, which is also more transmissible, in Western Australia they identified 2 cases of that, again both safely tucked up in quarantine hotels. No ongoing community transmission, and there's been no community transmission in Western Australia since the 11th of April. I mean, good grief. No community transmission since the 11th of April in Australia. You know, just a glowing example of what could have been. Instead, we're in this dire situation that we are currently in many Western countries, which will get better, but not for some weeks, as we've looked at. Let's just finish with a couple of pictures. Now we've followed the story of, if we're going to get the technology. Why is my pictures not opening? There we go. Computer's on a go slow. Now this is Danette, Humboldt County, California. I think she's a lab worker, medical laboratory scientist, we call them in the UK. And this is her 2nd dose. Now, she did feel a bit rough after the 2nd dose, going nicely into the body of the deltoid muscle, which of course is quite correct, other than like when we looked at it a couple of days ago. So it's nice of you. That's your 2nd one, Danette. And I know you did have a bit of a rough time after this, and you've said that, but I know you're feeling better now. So feeling a bit unwell after the 2nd dose is quite a common report, but now of course Danette enjoys a very high level of immunity, which is very, very good news. Now I've got one more picture I'll show you today, I think. Now this is interesting. This is from Paul in the Netherlands, and fingernails, of course, take time to grow. So what he says is this part of the nail smooth. There's a ridge in his nail here, and this part of his nail is rough. And this corresponds to when he started taking extra vitamin D. He reports he's taking 60 micrograms a day, which is just over 2,000 international units. So he's noticed the difference in his fingernail growth. He's noticed improved quality of fingernail growth. Now, no science there. It's just Paul's experience. But I thought it was interesting, especially since he'd gone to all the trouble of taking a picture with one of these microscope camera doodah things. So thought that was interesting. So that's us at the moment. In terms of new cases, and this does apply to the States as well. Cases are going down in the States, and certainly in the UK, we have turned a corner. In terms of prevalence, that corner was turned later. So the incidence corner was turned on the 1st of January. The prevalence corner was turned on, was about the 14th of January, quite a bit after, but whatever it was, about 9th, 10th of January on the COVID symptom tracker data. and the hospital corner should be turned, we hope, next week. But we're still dealing with immense numbers of cases. So it's going to remain very difficult for the next weeks. So we must hands, face, space, ventilate, isolate, and obey all of the rules that I think most of us now know, and things will start getting better. But of course we have to carry on paying the cost for the time being. I'm afraid that is the reality of the situation. It's a pity we are where we are, but this is where we're at. Therefore, that is what we have to do. Anyway, in the meantime, thank you very much for watching this video. Of course, it does feel good to communicate. It feels good to me. Hopefully, it feels good to you too, to communicate. And thank you for watching.